Alright, this is the valgus test. So I'm going to apply a lateral to medial force above the elbow and a medial to lateral force at the wrist, like this. And then I would move throughout the range of motion and do it again. And I'm looking for reproductions of the symptoms medially or compression laterally. This is the varus stress test. So I'm going to apply a medial to lateral force above the elbow and a lateral to medial force at the wrist, like this. And then I would do it in a slightly more flexed position, and I'm looking for symptoms at the lateral epicondyle or compression at the medial epicondyle. Alright, this is the rotary stability test. So I'm going to have the patient start out like this. I'm going to apply an axial load. I'm going to supinate the forearm and apply a valgus force while flexing the elbow, so it will look like this. And I'm looking for posterior instability or apprehension. Upper limb tension test 1 for median nerve. So I'm going to start by depressing the scapula to stabilize it and in this position. And then I'm going to move the patient into elbow extension, wrist extension, and finger extension, looking for the symptoms to be reproduced along the lines of the median nerve. Alright, this is upper limb tension test 2, also for median nerve. So again, I'm going to depress the scapula. I'm going to extend the elbow, extend the wrist, and extend the fingers while getting an external rotation. So it's going to look like this. And then again, you would feel pain along the median nerve distribution. This is upper limb tension test 3 for radial nerve. So I'm going to depress the scapula. I'm going to extend the elbow while flexing the wrist and the fingers and ulnarly deviating. And I'm just looking for symptoms to be reproduced along the radial nerve distribution. Upper limb tension test 4 for the ulnar nerve. So I'm going to start with the elbow in extension, the wrist and fingers also in extension, and then I'm going to move into elbow flexion, pronation, and radial deviation, and I'm looking for the symptoms to be reproduced along the ulnar nerve distribution. And then for any of the upper limb tension tests, you can have the patient laterally side bend to try and produce the symptoms more. This is Cosen's test. So I'm going to start by palpating ECRB. I'm going to have their elbow flexed, their wrist extended and in radial deviation, and I'm going to have them resist me moving them into wrist flexion and ulnar deviation. And then I'm just looking for reproduction of symptoms around the lateral epicondyle. Nose test for lateral epicondylitis. So I'm going to palpate the lateral epicondyle. I'm going to move the elbow into extension while pronating, ulnarly deviating, and flexing the wrist. And I'm looking for the lateral epicondyle symptoms to be reproduced. This is the third finger resistance test for lateral epicondylitis. So I'm going to palpate extensor digitorum, and then I'm going to have the patient raise their third finger, and then I'm going to push down and have them resist. And then we're just looking for pain at the lateral epicondyle. Medial epicondylitis test. So I'm going to palpate the medial epicondyle. I'm going to bring the elbow into full extension along with wrist extension, finger extension, full supination, and radial deviation. And I'm looking for reproduction of symptoms at the medial epicondyle. Elbow flexion test. So you're going to have the patient bring their arms into full flexion and then extension of the wrist. And then you would have them hold this position for 3 minutes. And after 3 minutes, if they had numbness or tingling along the ulnar nerve distribution, that would be a positive sign. Alright, this is Tinel's test. So I'm going to tap just proximal to the cubital tunnel like this. And I'm looking for reproduction of numbness and tingling along the ulnar nerve distribution. This is Wartenberg's test. So I'm going to have the patient fully abduct their fingers. And then I'll ask them to adduct their fingers. And a positive sign would not be being able to bring the fifth finger in. This is the test for pronator Terry syndrome. So I'm going to have the patient pronate while I resist, and then I'm going to bring the elbow into full extension. And I'm looking for median nerve signs to be reproduced because the nerve is being pinched between the muscle. This is the pinch grip test to see if the anterior interosseous nerve is being impinged. So I'll have the patient bring their thumb and index finger tip to tip, and that would be a negative sign. But if they brought them pad to pad, that would be a positive sign, and it would be because of FDP and FPL weakness.